If you look at the numbers and how it breaks down in regions across the United States, in some areas it exceeds 50% seropositivity. That means people are walking around with antibodies in their blood that are detectable that shows they've been exposed to Lyme disease at some point in their life. Now, whether it was in the past and they've been successfully treated or whether they have it right now, you can't tell by that result, but it's a marker of exposure. It's very helpful for people to know that Lyme disease is not just a problem we have in the United States, and that it of course goes up into Canada, but also that in Europe and Asia they also have Lyme disease. And as we raise awareness, there will hopefully be more studies like this to look at where people are getting exposed to Lyme disease and how many people have been infected in the past. We need to understand the disease and where it is so that we can work on better ways to detect and treat it. Also, some people may have a rash and not know it if it's on the back of their head or other hard to see, hard to reach areas. If the infection is not treated right away, the patient may then also progress to having other symptoms like disseminated rashes, joint pain, arthritis, and even neurologic involvement. And they can even have one-sided facial paralysis called Bell's palsy. If a patient lives in an area where there's a lot of Lyme disease, finding a tick that's been attached to them for more than 24 hours, ideally more than 36 hours, that in and of itself is enough should prompt them to go to their physician to see if they should get some antibiotics to prevent Lyme disease. But I would also say if people present with any type of illness during the spring, summer, or fall months when they've been exposed to ticks, where they may have a rash, a headache, a fever, those could all be signs of tick-borne diseases, Lyme disease and other diseases, and that should prompt them to go to their physician. I also like oil of lemon eucalyptus, which has been shown by the Environmental Protection Agency to be almost as effective as DEET and smells a little better. Also, wearing permethrin sprayed on clothing is helpful. That also will repel and even kill ticks. And then just covering up with clothing so that the ticks can't get to your skin. If you tuck your pants into your socks, you're taking away an avenue for ticks to get to your legs to bite you.